Good evening, everybody. I'm Pam Moore. Today, a local congressman got a first-hand look at how prepared Bay Area hospitals are should a patient stricken with the Ebola virus show up for treatment. Crown 4's Dan Kerman was there. He joins us now with all the details. Dan.
Well, Pam, this took place at San Ramon Regional Medical Center. It's Congressman Swalwell who coordinated a meeting of doctors as well as hospital administrators and others throughout the East Bay. He wants to make sure that everybody is on the same page when it comes to the do's and don'ts of treating Ebola.
I think that would go a long way, if I got an email from my doctor saying, here are the myths, here are the facts.
Ebola preparedness was front and center Tuesday as East Bay Congressman Swalwell hosted a meeting for East Bay doctors, nurses, and hospital administrators and the Centers for Disease Control.
I was confident after talking to our healthcare officials here in the East Bay that they are ready.
Still, those in person and on the phone had plenty of questions for the CDC.
There were questions about what to do with medical waste. There were questions how to treat people as they came in, but also questions about which suits that they should, when is it time to go to the hazardous suits that we've seen on TV.
Getting in and out of that personal protective gear is quickly becoming the #1 concern for those on the front lines since a Texas nurse contracted Ebola after caring for a stricken patient.
It's concerning to nurses, and they want to become more educated. They want more drills. They want more practice, and that's exactly what we're doing.
Registered nurse and San Ramon Regional Medical Center disaster coordinator Marianne Cordelia says drills were conducted last week at San Ramon Regional, and that will be ongoing.
All of us as a community are trying to get more educated and trying to become more comfortable with the appropriate guidelines and trying to get better trained with removing the personal protective apparel.
Congressman Swalwell also talked about budgets, specifically those of the CDC and the National Institute of Health. He says they've been cut by millions of dollars over the last several years. He says that's really impacted our fight in West Africa as well as vaccine development here in this country. He says he's going to be meeting with those two agencies come next month in hopes of restoring all or part of their budgets.